Welcome to another easy nursing review. In this lesson, we will cover Addisonian Crisis. But before we begin, let's see if you can get this answer correct. A 62-year-old woman named Mrs. Jackson was brought to your unit in an Addisonian crisis. Her blood pressure is 86/58, her pulse is 112, and her respiration is 18. She is sluggish. You find out during your conversation with her daughter that Mrs. Jackson had a bilateral adrenalectomy 25 years ago to address her Cushing's condition. Since then, she has been taking 200 milligrams of hydrocortisone and 150 grams of fludrocortisone, also known as Florinef, every day. She got the flu 3 days ago. Why is an adrenalectomy done to treat Cushing's syndrome? What is the most effective schedule for Mrs. Jackson's medication? What precipitated this Addisonian crisis? Comment what you think the answer is in the comments below. Now, let's begin by first learning, what is Addisonian crisis? Addisonian crisis is the most severe form of the disorder as the disease progresses, commonly as a result of a stressful event such as surgery, trauma, or severe infection. Now, here are the signs and symptoms of the patient. The patient will present with cyanosis and the classic signs of circulatory shock. Remember, the signs of circulatory shock are pallor, apprehension, rapid and weak pulse, rapid respirations, low blood pressure, confusion, and restlessness. Note that if the patient is left untreated, it may eventually lead to death. Now let's go over important labs and diagnostic tests. The most definitive diagnostic test is the adrenocorticotropic hormone stimulation test. This test evaluates plasma cortisol levels that do not rise after administration of the adrenocorticotropic hormone. Now let's quickly go over labs. Labs will reflect the following low levels of serum cortisol, low fasting serum glucose and serum sodium, elevated serum potassium, and ACEH. Head CT and MRI may help to determine if a pituitary problem is responsible for the adrenal insufficiency or if atrophy of the adrenal gland is present. Okay, let's move on and learn about treatments for Addisonian crisis. Note that immediate treatment is directed toward combating circulatory shock. Think of it in the simplest terms of restoring blood circulation, administering fluids and corticosteroids, and monitoring vital signs. Administration of hydrocortisone I4 followed with 5% dextrose in normal saline. Vasopressor amines if hypotension persists. Antibiotics if infection is the precipitator. Lifelong replacement of corticosteroids. For primary disease, replacement of mineralocorticoids is also needed to prevent recurrence. Different schedules of daily dosing are used, and there is no agreement on which is best. Often 2/3 of the dose is given in the morning and 1/3 at night. Alternatively, 3 doses per day may be given to more closely mimic the normal diurnal rhythm. Additional supplementary therapy with glucocorticoids during stressful events. For minor stress, the glucocorticoid dose is generally doubled. For major stress, 200 milligrams per day is given in divided doses and then tapered as recovery occurs. Excellent. Now let's move on to nursing actions. The nursing actions include the following: interventions to promote fluid balance and monitor for fluid deficit. These interventions include weighing daily, recording intake and output. Assess vital signs every 1 to 4 hours. While checking the patient's vital signs, you will want to especially be on the lookout for the presence of dysrhythmias or postural hypotension. Administration of chiexolate may be needed if severe hyperkalemia is present. Monitor blood glucose levels every 4 hours for hypoglycemia. Monitor effects of replacement medication. Note that generally divided doses are given, with 2/3 in the morning and 1/3 in the late afternoon. Manage activity intolerance with gradual increases in self-care activities. Teach the patient ways to minimize anxiety and stress. And with nursing action comes patient education. Teach the patient the following: wear a medic alert with the name of the disease, medications, doses, and physician. Always carry medication with you when traveling and be sure to bring extra doses in case of unexpected need. Never skip a dose of medication. Teach the patient to increase the dose of glucocorticoid as directed when minor stresses occur, such as personal or family issues, accidents, dental work, or infection. Report signs of inadequate dosing immediately, such as anorexia, nausea and vomiting, weakness, depression, dizziness, polyuria, or weight loss. Report signs of overmedication immediately. Signs would include rapid weight gain, round face, edema, or hypertension. Maintain a regular schedule of eating, sleeping, and exercising. Maintain a fluid intake of at least 2 liters per day unless contraindicated. Eat a diet with normal amounts of sodium. Increase sodium if diaphoresis is expected. All right, well, you made it to the end of the video. Back to that question at the very beginning of the video. A 62-year-old woman named Mrs. Jackson was brought to your unit in an Addisonian crisis. Her blood pressure is 86/58, her pulse is 112, and her respiration is 18. She is sluggish. You find out during your conversation with her daughter that Mrs. Jackson had a bilateral adrenalectomy 25 years ago to address her Cushing's condition. Since then, she has been taking 200 milligrams of hydrocortisone and 150 grams of fludrocortisone, Florinef, every day. She got the flu 3 days ago. 1. Why is an adrenalectomy done to treat Cushing's syndrome? 2. What is the most effective schedule for Mrs. Jackson's medication? 3. What precipitated this Addisonian crisis? Now here are the answers. 1. An excess of cortisol is the etiology of Cushing's syndrome. The cortisol is secreted by the adrenal cortex. 2. The recommended dosage for Mrs. Jackson's hydrocortisone and fludrocortisone is 2/3 in the morning and 1/3 in the evening. This most closely resembles how the body naturally secretes corticosteroids. 3. This crisis was most likely brought on by the virus. The body typically releases steroids in response to stress, and illness is a stressor. Mrs. Jackson suffers from hypoadrenal symptoms under stressful situations because her body cannot manufacture steroids. If you got it right, awesome. If not, that's okay. Just keep studying. Well, that ends this lesson. Click here for another nursing video.